This patient came to see me with issues on tooth number 12, and she was terrified that she was going to lose this bridge. So if you look closely, is there an apical split or bifurcation? So we did limited field of view 3D CBCT. We can see the bony destruction caused by the infection in the tooth. The diagnosis was a necrotic pulp with chronic apical periodontitis. So we're looking around to make sure there's no cracks or no fractures, so everything else looks stable, so we can proceed with the root canal treatment. The question is I have for you, would you do this in one visit or two visits? Well, I decided to do this in one visit, but before that, I wanted to get more information. Look how large this area of infection is. The bone is totally gone in that apical 1/3, and this is the coronal slice, so we can see it as well. So we have a case like this. It's very important to know that we have a bifurcation at the apex. So look at the cone fit. Look at it very closely. You can see the gutta percha here. There is a bifurcation at the apex. These can be very, very tough. This is the completion here. We brought the patient back in 6 months. Look at this beautiful bone healing. Look at this osseous healing. It looks as if nothing ever happened. Beautiful bone healing. And I really don't believe you can get this kind of bone healing this fast without using bioceramic sealers and the proper irrigation techniques. So very beautiful healing in a very short period of time. Again, this is only 6 months. Look at this nice bone healing here on this sagittal slice. You can look at the coronal slice. The coronal slice shows the bifurcation here, and look at the healing that's happening here. And as we go through the axial slice, you'll be able to see the apex actually split with the bifurcation going almost distally here. So again, this is the 6-month recall showing beautiful healing. On this case, this patient was asymptomatic, and they were actually grateful that I was able to do this in one visit versus 2 visits. And these can be done successfully in one visit, no problem at all, especially using bioceramic sealers, because the bioceramic sealers also create calcium hydroxide, hydroxyapatite, that facilitates the healing. I'll talk more about this in my endodontic textbook available on Amazon.